Hey, good morning. I'm Vic Senese. I'm the host of the UroPatient podcast. Welcome to the show. We got a great show for you today, so join us now. All right, so welcome everyone, and thanks for joining me today. We'll be talking about urethral strictures, what they are, why they happen, and the symptoms they cause, and treatment options available. My goal is to help you understand this condition in clear, patient-friendly terms. And I've had a couple of requests for this from patients about questions that they asked about urethral strictures and how to treat it. So thought it'd be a good time to cover this. So what is a urethral stricture? It's a narrowing of the urethra, the tube that carries the urine from the bladder to the outside of the body. Now I've got a nice picture here. You can see that area showing that stricture there. So, and then we see the bladders up there, and then as we come down. So these strictures can form anywhere along that tube. The narrowing is caused by scar tissue or inflammation, and it makes it harder for urine to flow normally. Kind of like as if you had a pipe that was, had buildup in the middle of it, or a hose that you stepped on the center of it and it's now crushing it, so it's not working the way it should. Strictures are far more common in men simply because they have longer urethras. They can happen at any age, although they're more common in adults. Many people live with symptoms for years before getting a diagnosis. Now, the symptoms often start with a weaker urine stream or strain you urinate. You might notice more frequent urinary tract infections, burning when you go, or feeling that your bladder isn't fully emptying. These symptoms can worsen over time if not treated. Interestingly, these are the same symptoms that you can get with an enlarged prostate. So, if you're not sure, you may need to go in and have it evaluated, because sometimes people think their prostate's causing the trouble and it's a stricture. Now, strictures have many different causes. Trauma, one of the most common things. So trauma, like you got into an accident where the toilet seat fell down on your penis, or some other thing, got in a car accident and it could have caused it to happen, or an injury to the urethra. They all can lead to scarring. Now, sometimes repeated use of a catheter or medical procedures can even trigger them. So if you've been catheterized or had a cystoscopy, not that they're high risk of having a stricture after that, but sometimes if they're done frequently enough, it's a possibility. Now, infections, especially sexually transmitted infections, are also a factor. In some cases, we never really know what the clear cause was. We call that idiopathic. Now, strictures aren't just uncomfortable. They have serious health effects. If urine isn't flowing well, the bladder gets strained and infections become more common. Over time, untreated strictures can cause bladder or kidney damage. Now, to diagnose a stricture, your doctor is going to start with a simple history and find out your symptoms. They may check how fast the urine flows doing this test called a uroflowmetry. That's where you urinate into a special flow meter and it checks how fast the urine's coming out. Interesting, I'm going to have somebody coming on my show in the near future, and I'll try to do something with you guys for UroPatient, for something that can actually use your phone to listen to the flow hitting the toilet, just the sound of it, and figure out your uro flow. That's going to be cool. Imaging or cystoscopies we've talked about in the past, where they go up with a telescope and look inside. They can see that stricture. Or some diagnostic tools like x-ray studies that use a dye. So we'll talk about those. So let's start with an x-ray study. We have an x-ray study right here showing a stricture. Now I'm going to show you where that's at, right there where that arrow is pointing. So normally that's the dye is filling up the urethra and it looks like that. Dye shows up white. That's your bladder up there with dye in it, so it's showing up white. And then then we can kind of see it's coming down until it reaches that little narrow spot. That's a stricture. Pretty easy to see on the x-ray. Treatment really depends on the size, severity, and location of the stricture. Remember I said anywhere along that tube it could have had a narrow spot. Towards the tip, it's different than if it's deeper close into the bladder. Options range from simple procedures to more complex surgery, but the overall goal is the same: to restore normal urine flow and protect your urinary system. Now, in less severe cases, doctors typically use something called dilation. Those are those instruments that you see in the picture. I've been involved in urology for a long time, and I can remember that was the mainstay. Patients with strictures would come in, the doctor would put that rod through the penis, pop open the scar, and sometimes it stayed open. Mostly it came back, and they would be coming back 6 months later, a year later, but somewhere along the line, it would rescar, and they'd have to have that same device put through. Sometimes temporarily putting a catheter in even can help to open up the strictures, but they're usually not permanent solutions, as I mentioned. I'm going to talk about something that you can do that's I consider more permanent. Now, this is my protocol. So I was, like I said, I've been doing urology for a long time. Had to help out with these dilations with those instruments. No fun for patients to go through. And I thought, there's got to be a better way. And I had always taught patients how to do self-catheterization. So I said, hey, what if we just had patients catheterize themselves on a regular basis? They could pop open the stricture with one of these devices, a simple urinary catheter. These self-cats, we use them for people that can't urinate. So that's what I did. I came up with the protocol, talked over with my docs about trying it, and I had everybody convinced. I work with a group of urologists. They all started doing this dilation, self-dilation. Now, it doesn't work for all strictures, but for a lot of these simple ones. So let's talk about how this works. So what I do is I have them dilate with, now you can see they have different colors there, green, red, blue. The color has to do with the size. Most commonly, you want to have at least the green, which is a 14 French. 16 is about the normal urethral size. If you've got a really tight stricture, you might start with the 14 or the 16. The red one's the 18. It's a little bit bigger. So depending on the size, I would figure out which one to use. And I would have them catheterize themselves daily, once a day, for 4 weeks, popping through that stricture. Now, once we've opened it up, usually putting a catheter through it for the repeated times, not too bad. Sometimes you'll feel a little pressure as it pops through. So kind of take my catheter out here and see if I can do a little demo of what I'm talking about here. So what we're doing is we're catheterizing, and we're pushing. And then when you get to that stricture, it may take a little bit of a push, but it'll pop right through. Let the urine drain out, remove it. Get a new catheter, do that the next day. Again, for 4 weeks. Then, if you're getting the catheter in, no problem, and whichever size we're telling you to use, then you go to every other day for 4 weeks. So you skip a day. So you do it every other day. Still popping through, no trouble. Now we go down to once a week for 4 weeks. Again, if after 4 weeks you're able to pop this thing through, what you probably did was create a scar that's open, big enough to urinate through, and doesn't require further catheterization to keep it open. So you want to scar it open. That's kind of working with the scar that's going to form anyway. Now, if you start having difficulty anywhere in the process, you just go back to the previous one. So you go back to the every other day or the daily and then work it through. But I've had really good success with this routine. So talk to your urologist about that if you have a stricture and you want to try this, see if they're agreeable to it, because, again, I've had a lot of good success. And I'll also have this protocol in the handouts on the website. Now, surgical options include things called like a urethrotomy, where the scar tissue is cut open in the urethra, and urethroplasty, where they do a repair or reconstruction of that area. Urethroplasty usually has the highest long-term success rates, especially in severe strictures. So these are ones that are a little bit harder, where a patient wouldn't be able to probably pass a catheter through, that we would do a formal operation. But now we've got this new system that's really been working good too, called Optilume. Optilume's a new treatment for urethral strictures that uses a special balloon to gently stretch the narrowed part of the urethra. Which makes it different from older treatments is that the balloon is coated with a medicine called paclitaxel. Fancy word, but it's actually a chemotherapeutic drug, which helps stop the scar from coming back, causing another blockage. Procedure is quick, done as an outpatient, and many patients go home that same day. I would say almost every patient I know has gone home the same day. For people who have struggled with repeated strictures, this may be a more long-lasting result. So let's talk about what's happening here. So this is our Optilume balloon. That balloon's right in there. So it's skinny when they put it in, so it passes through, looks like that wire, and it passes right through that stricture, And then the doctor inflates it to a certain pressure, and that pops open the stricture. Now, of course, we've been ballooning those things for a long time, but the strictures always came back. Well, now they coated it with this paclitaxel, and that coating, that medicine on there, helps to keep it from healing shut. So it prevents that scar healing. So that's the whole goal. So you get to have that done in a pretty simple procedure that may give you a really long-term result. Much easier than those surgical procedures. Now, living with a stricture means paying attention to your body. Stay hydrated, watch for changes in symptoms, keep up with follow-up visits, very important. If your symptoms get worse, tell the doc right away so treatments can be adjusted. You don't want to wait till it shuts off and you end up in an emergency room, because that's a bad situation. If you've got a stricture and you don't have a urologist that knows how to get through it, they're going to struggle trying to get a catheter in you, and you're going to be in a whole lot of hurt. Now, not all strictures can be prevented, so all these things don't always work. Everybody's different. But you can reduce your risk by practicing safe sex to prevent things like STD-related strictures, using catheters only when needed, protecting yourself from injuries, and seeking early treatment and if urinary problems develop. Now, these are some of the most common questions patients ask. Treatments are done with anesthesia is it painful? They're done with anesthesia to minimize discomfort. We can use a local anesthetic, a numbing agent into the penis, and that can take away most of the pain. If it takes more than that, we can also give you some other medications. We do things under this nitrous oxide gas and stuff like that makes it really simple. Will it come back? Strictures can return. A lot of times they're going to return if you're just doing that plain old big fish hook thing you saw, that dilator. Those are called sounds, by the way. If you're just dilating with sounds, I can almost guarantee it's going to come back. Surgical procedures may give you the best long-term procedure results, but you try that dilation I talked about with self-dilating with a self-catheter, or the Optilume. You may have really good long-term outcomes from that. And how long does it take to recovery? Well, most of the procedures recovery is pretty quick, but depending on what's done, you're going to have a little bit of soreness from, the stretching of that stricture. It's kind of like almost a small cut in the urethra, and it's got to heal. So I hope this was helpful for you. Again, I had a lot of requests for people that were talking about, asking questions about urethral strictures, and look back, and I really didn't do anything on urethral strictures, so I thought this would be a good time to address that. So tune in next week for more UroPatient.com. Hope you enjoyed that episode. Tune in every week for more on the UroPatient podcast.